Welcome to the LHM Group of companies. We're happy to have you on board and hope you have a fantastic experience. As a full-time employee, you are eligible for certain benefits. This benefits overview will give you a high-level introduction to the Larry H. Miller benefits package. If you need more detailed information, please review your benefits guide or your summary plan description, which can be found on our benefits site. Let's get started. Benefits eligibility for most of our benefits are as follows. First of the month, following 60 days of full-time employment. You may either enroll or waive. If you take no action, then we will take that as a waiver. You must enroll prior to your eligibility date. Once your eligibility date has come and gone, you can no longer enroll in the plan. To enroll in benefits, please go to portal.adp.com. During the year, you can view your benefits at any time at this portal. To make changes during annual enrollment, you will also go into this portal, but you will need a registration passcode, which is LHM-group. Again, please remember to enroll prior to your eligibility date. The Larry H. Miller Group offers a comprehensive benefits package which includes the services and plans listed on the screen. Let's take a moment to review each of them separately. Our medical plan covers in-network preventive screenings such as physicals, mammograms, immunizations, and colonoscopies. Please make sure to stay in-network to receive the full 100% coverage. On Cigna, you would need the Open Access Plus network. For United Healthcare, it would be the Choice Plus network. When you see your doctor for issues other than your preventive screenings, the plan pays 80% and you pay 20%. Remember, the doctor needs to be in network to have this coverage. Deductible does not apply. If you happen to see a specialist, such as a podiatrist, a gynecologist, or oncologist, the plan pays 70%, you pay 30%. Again, make sure that the specialist is in network and the deductible does not apply. If you are ever in need of medical services, we have a virtual option which offers you the opportunity to speak to a doctor from the comfort of your home or if your doctor is not available. You will pay a $15 copay for this call. On Cigna, the program is called MD Live, and United Healthcare, it is called Virtual Visits. This is also a great option if you happen to be traveling. If you are in need of non-emergent care, such as minor cuts, burns, sprains, or strains, urgent care would be a great alternative to the emergency room. You don't have to wait as long, or you don't have to pay as much. Search out urgent care facilities where you live so you know exactly where they are when you need them. The deductible does not apply. For inpatient, in-network hospital stays and outpatient day surgeries, the plan pays 80%, you pay 20% after the individual deductible is met. The deductible is $1,500. If you happen to use the emergency room, the plan pays 80% and you pay 20% after you pay a $200 copay and after the deductible is met. If it is not an emergency, use other options such as an urgent care. Reasons to use an emergency room would be for chest pains, loss of consciousness, difficulty breathing, or uncontrolled bleeding. If you happen to be admitted into the hospital, the $200 copay will be waived. Remember, if this is not an emergency, please make sure to use other options. They will save you money. If you happen to need prescriptions, always ask your doctor for generics. Generics will always save you money. You will pay a $10 copay for generics. On the preferred tier, you will pay 30% up to $125 per prescription max. And on name brands, you will pay 50% up to $150 per prescription max. In Utah, you have two choices, Cigna and United Healthcare. What is the difference between the two? The doctors on each network are different. If you already have a doctor, please ask the doctor whether he or she contracts with United Healthcare or with Cigna. It is very important to have a primary care physician. The primary care physician can partner with you to create a baseline for your health and let you know if you need further care, including references to specialists. What's the difference in hospitals? The hospitals under United Healthcare would be the IHC hospitals. Primary Children's Hospital and Huntsman are in both networks. If you already go to a hospital that you like, please make sure they are either under the United Healthcare network or the Cigna network. Once you have selected your carrier, register online either on myuhc.com or mycigna.com. Great information can be found on these websites to help you become a better health consumer. They'll help you find doctors, find best facilities for procedures, find your claims information, and explanation of benefits. Be sure to register so you have immediate access to this valuable resource. Let's talk about our dental plan. Our dental plan has preventive services such as exams, cleanings, x-rays, which are covered at 100% in-network. Our basic services, such as fillings, crowns, and dentures, are covered at 80% after the deductible. Major services, such as bridges, inlays, and onlays, are covered at 50% after the deductible. The annual maximum benefit is $1,250 per person. Our dental plan has two options. Plan 1 has orthodontia, which covers children up to age 19, and Plan 2 that does not cover orthodontia. Our voluntary vision plan is administered by United Healthcare. This plan offers employees the opportunity to purchase hardware at a discounted rate. You also receive 15% off standard prices or 5% off promotional prices on LASIK or PRK surgery. As you can see on this slide, there is quite a bit of detail on the lens, frame, and contact options. I would invite you to review the benefits guide to see whether the voluntary vision plan would be a good fit for you and your family. Let's review the 2016 cost of our plans. Remember, you can also find this information in our benefits guide. The cost of our medical plan is as shown on this slide, and it is broken out in 4 tiers. As you can see with the dental plan, the costs are broken up into Plan 1 and Plan 2. These are the costs of our 2016 monthly vision plan. The Larry H. Miller Group offers a flexible spending account which allows employees to put money aside pre-tax for health and dependent care reasons.
I'm being offered a pre-tax flex spending account at my work for my medical bills. I'm 24, I rarely get sick. Is flex spending worth it?
Well, in general terms, it is worth it because most people are not always healthy. So let's explain what Flex Spending Account, or FSA, is. It basically allows you to contribute pre-tax dollars to an account that your employer administers for qualified expenses, which can be prescription drugs, office copays, deductibles, eyewear, vaccines, yada, yada, yada.
So that, for example, if we have a health care plan here, and that would mean is that if we had a flex savings, I don't think we do we?
Yes.
We do. I could put additional money into that and then use that for my copays, and it would be tax deductible.
Yes. You can use it for orthodontia, dental fillings, extractions, chiropractic, acupuncture services, contact lenses, cleaning solution, prescription sunglasses, reading glasses, insulin, diabetic supplies, infertility treatments. That may or may not be an issue.
You're right in there.
Pregnancy test mark. I don't know. Hearing aids, batteries, genetic testing. So you don't have to be sick necessarily to be able to use it. Now, let me do the math for you real quick.
Okay.
So if you made $50,000 a year,
Yep.
because this comes out pre-tax.
Correct.
You don't pay Social Security tax. You don't pay federal tax,
Okay.
state tax. So at the end of the day, if you made 50 grand a year, you would end up, let's say you put $2,000 in the FSA.
Yeah.
At the end of the year, you would end up with after-tax income of $36,158 versus $35,505. So it's an extra $653.
Bucks. And for if you wear glasses, and I go
Yeah.
in every year to get an eye exam, I suppose it covers that.
Now the
And-
max you can put away is $2,500, but it is a use it or lose it. So you got to figure out how
Oh,
much you're
in
going
the
to
year.
spend.
Oh,
So you
in the
lose it
year.
if you don't use it.
So anyhow, that would seem to be, quote, for most people,
It is.
a good deal, and they should do
Yeah,
it.
and maybe you don't do 2,500, but maybe you do 500 because still, I
Hey,
mean,
a married couple with a couple of kids tell me they're not going to be ripping through.
Oh yeah.
How does the flexible spending account work? First, you estimate your medical expenses. Then, you divide it by the amount of paychecks you have for the rest of the year. You incur your expense, then you pay it with your debit card. We encourage you to put money away in your FSA account. As you can see in this example, you can save quite a bit of money by doing so. The Larry H. Miller Group pays basic life and basic accidental death and dismemberment insurance for employees and dependents through Mutual of Omaha. The employee benefit is $25,000, the spouse benefit is $5,000, and the dependent children is $5,000 each. You may purchase more life insurance on yourself and your dependents. You may purchase the lesser of 5 times your salary or $350,000 with no medical underwriting when you are newly eligible. You may also purchase up to $50,000 with no medical underwriting for your spouse. You may also purchase short-term disability insurance, which is also administered by Mutual of Omaha, for non-work-related illnesses or accidents. Remember, workers' comp covers accidents which occur at work. You have the option of either selecting 40% or 60% of your salary. The benefit will pay up to a weekly maximum of $1,500. There is a 7-day waiting period and a 13-week maximum benefit. Pre-existing conditions do apply. The company provides long-term disability at no cost to you through Mutual of Omaha on January 1 or July 1 following 12 months of full-time employment. The benefit provides income replacement of up to 50% of your W-2 earnings. There is a 90-day waiting period, and you receive 50% to $5,000 per month based on your W-2 income. It is a 2-year benefit. You have the option to buy up your long-term disability based on 60% of your W-2 earnings up to a maximum monthly benefit of $10,000 to Social Security age. The same eligibility applies as the basic long-term disability. All employees and dependents covered under our basic life insurance have access to the Employee Assistance Program. The program provides confidential and professional resources to cope with any personal or work-related issues. Each member of your family is eligible to receive unlimited telephonic counseling sessions and 3 face-to-face sessions each year. This service is completely confidential. Personal information is never shared with anyone. The Larry H. Miller Group offers a 401k plan for part-time and full-time eligible employees.
What does retirement mean?
You could just say, boss, I'm getting old. Can I please go home now? I'll forget about the money. Forget about working. Forget about everything else. I'm going home and rest. And that's all.
What is a 401k?
401k. It's a news station that they talk and sing a lot. Crunchy cereal. A Barbie. Ravioli.
Not really, but close. Any advice?
You should start probably now today. Saving your money so you can get things and buy things. You have to save early. You have to go get some money early. You should save, save, save.
It's never too early to start saving for your future.
The Larry H. Miller Associates Retirement Plan provides you the opportunity to save for your retirement. After you become eligible, you are automatically enrolled at 1%. Larry H. Miller matches 50 cents for every dollar up to 6% of your salary pre-tax. So please make sure you take advantage of this. You can defer from 1% to 50% of your salary. The Larry H. Miller Group wants you to get fit for the future. The company cares about your health. That's why we created a well-being initiative designed to help you engage in a healthy lifestyle.
Diabetes is just an ugly, ugly disease, and I didn't know he had it for a long time. He didn't talk about it, he didn't acknowledge it. He just thought, you know, I'll get better. If I ignore it, it'll go away. He went through so many things that were related to the diabetes. For people who have not seen this disease, they don't want to see it. It was just dying by bits. And when I think about him being gone, we have new grandchildren, new great-grandchildren, new sons-in-law, new daughters-in-law. We have a lot of family things. The business has changed. Life goes on. But when you're not there to share it with the one you love, who is part of it, it's really sad, especially when it didn't have to be that way. We miss him terribly. He was only 64 when he died. Yeah, I think about it a lot.
The Larry H. Miller Group partners with Sonic Boom to administer our well-being program. You will find tools, contests, and challenges that will make it fun and rewarding. For more information, contact your Human Resources Department at your location. Now that we have reviewed all of our benefits, I would like to remind you to please elect before your eligibility date. All elections will be set in stone for the rest of the year unless you have a qualifying event during the year. Qualifying events are marriage, divorce, adding a dependent child through birth, adoption, or change in custody, your spouse or your dependent dies, your dependent loses eligibility for coverage, or your spouse loses or qualifies for health coverage through his or her employer. The one thing you must remember is that the change must be made within 30 days of the qualifying event date. Please remember this. If this time frame does pass, you will not be able to make the change until the next annual enrollment period. As a review, please make sure you understand your plan design, be actively involved in your healthcare, use in-network providers and generic drugs because these will save you money. Make use of your online tools such as your carrier websites and our employee website. Make informed choices and decisions on your health and well-being. If you have any questions, please see your Human Resources Department, or you can also visit our benefits website. Thank you for your time, and we wish you well.